Hi, I think this is more for uh, Coach Locks. I know you guys were in the hotel through Sunday, but I was wondering if you could kind of just walk me through the timeline from then until the next round of positive tests.
Till the next round of positive tests.
Yeah, just kind of like what the team protocol was and in terms of like isolation and that sort of thing.
Yeah, we stayed in the hotel until Sunday morning. On our way out, we took another antigen and PCR test, and then we allowed our players to return to their personal living quarters. And then we continued our PCR testing Monday, Tuesday, Wednesday, and have continued both the antigen and PCR testing through today.
Thank you. I hope you're doing well.
Thanks.
Next question, let's go to Alex Dacey. Alex?
Hi, I think this is kind of just for the room, but when you guys initially moved out of the hotel on Sunday, did things look like they were moving in a good direction, and then there was sort of a sudden surge in the last couple of days? And could you just sort of explain, like, was this surge, did these cases kind of keep surging, or did it look good and then there was another spike like in the last couple of days?
Dr. Rooks, let's have you answer that one.
Sure. So yes, Alex, things are moving in a good direction. I have confidence that we're going to get back on the field. And as we all know, this is a day-to-day operation when dealing with COVID. And COVID is very tricky and very slippery. And then we noticed that we had an uptick in cases, and so we put a halt on the program's activities.
Did you see that uptick yesterday or in the last couple of days, or was it sort of just a steady increase throughout the weekend?
No, it actually went down over the weekend, and then we saw an uptick early in this week.
All right, Emily with the Washington Post. Let's go to you next. Go ahead, Emily.
Hi, everyone. Thanks for doing this, and hope everyone's okay, including Mike. I think this is for Damon, unless Dr. Rooks wants to chime in. Just with the overarching view of the entire athletic department, with over 100 athletes testing positive. If someone would have told you that would be the case months ago when we were talking about bringing back sports, would you have been comfortable with that number? And does it concern you that so many athletes at Maryland have contracted the virus?
I think anytime you have student athletes who are sick, or in this case that have contracted the virus, you do have concern. So yes, I do have concern for the young men and young women within our department, within our program. When you take a look at COVID, we knew that going into this was uncertain. You have to follow the science. This virus, as we know across the country, is really on an uptick right now. So our goal was to make sure that if we decided to get back to participating and competing, which we did as a conference and an institution, that we put in the appropriate medical guidelines and protocols. And I believe we have done that. I think, as Dr. Rooks has always alluded and said, this is a community spread virus. And so our job is to try to mitigate that spread as much as possible. And that's what we've done. Unfortunately, yes, we're in a situation in which having to cancel 2 football games now, and seeing the uptick in our football program, and seeing some of the things that's happened across our athletics department, they give you calls for pause, and that's why we did pause. But I do feel like we've got measures in place that will allow us to mitigate this, get ourselves back in the position to play. But each day is different, and this is rapidly evolving, and we will adjust accordingly.
And I just want to add that we had more cases before we started sport, and we've had less cases after we started with our Big Ten protocol. So we went into this knowing what we're doing, and I just want to remind everybody that not all of our cases were active positive cases. We also included our number of people who had positive antibodies, so were exposed before they came back to school.
And could I just ask you, Dr. Rooks, the players who have the virus now, are they all doing okay? And what's the extent of like symptoms, mild, severe, and how are they doing? And coaches too.
I would say everyone is doing well.
And can you say anything about symptoms, if they're showing symptoms?
I mean, everyone's showing the range of motion symptoms: fever, cough, congestion, things that you would see with a common cold, but we know they tested positive for COVID.
Thank you.
All right, let's next go to Andy Koska. Andy, go ahead. You're on next.
Hey there. Thanks for doing this. Hope everyone's okay. This is for Dr. Rooks. So just wanted to, it's very difficult probably to track, but have you been able to figure out how the how the infections have spread from person to person? Has that contact tracing been effective at this point?
So yeah, and I'm gonna be pretty blunt about it. We have 3 sources that we have led to all of our cases, and to protect identities. And of course, I'll just say that yes, contact tracing has been beneficial. The young men, especially in our football program, but with all our sports, have been honest. They realize the severity of this program, and as Damon and Mike always say, they are their brother's keeper, and we want everyone to be healthy and safe.
Are you able to say what the 3 sources are?
No.
All right, next question is Adam Rittenberg. Go ahead, Adam.
Yeah, thanks for doing this. Hope everybody's doing okay. And I'll just kind of throw this out to everyone. When this has happened, it seems to be normally like a two-week deal, and then teams are able to get back to performing and playing. Is that the anticipation, or how will it be deadlines coming up that you feel you'll have to meet, especially you, Mike, as the coach, to feel like your team can have enough time to prepare for the next game?
Yeah, as far as preparation, what we've worked off of, Adam, is whatever rules we get for that day. When we're told we can practice, we'll have a plan in place to get our team prepared to put out a team that will go out and compete. Is there some ideal times and numbers that you like from a practice standpoint? Sure, but we've done quite a bit virtual teaching and learning. For us, I think the big thing is the cardio conditioning of our players, as well as, just having not played the game in 2 weeks. And that's something that once we get the go-ahead from Dr. Rooks, we'll evaluate as we return on a daily basis.
Is there a minimum amount of time that you guys would need to get ready, in your opinion?
We've always said, and we had a plan in place that if we could get 2 practice days in, whether it was a 2-a-day where we went in the morning and went in the afternoon, we had all types of contingency plans as we prepared for Michigan State that we had in place, and we will continue as we get information from our medical people and the protocols to put the best plans in place to have our team prepared to go play.
All right, great. Next question is from Heather McDonough. Hey, Heather, go ahead and unmute yourself and ask.
Hey, everybody. My first is for Coach Locksley. Obviously, I hope Sunday you all are best. The press release said that you have had minor symptoms, and I wonder what you can share with us since you learned about the test, maybe the range of emotions that you've gone through, knowing that, you and your players are going through this together, as you kind of maybe could take us through that, whatever you are willing to share with us.
Yeah, I would say that, obviously I feel very strong and healthy as we work through it. That I have some minor symptoms, sure, whether it was a small cough, a runny nose, those type of things, as Dr. Rooks alluded to, very similar to the common cold. Once I got it on Monday night, I reported it to Dr. Rooks, and we went from there. I think the big thing is, as we've told all of our players and everybody in our program, that if you feel yourself have any symptoms, that we should report them, and then we'll take the appropriate steps, which I have done and we've done.
Were you surprised at all, I guess, or in this day and age, is it hard to be surprised, like even knowing all the precautions you and your players were taking?
Yeah, obviously surprised, but when you have the type of spread that we've had within our team, you come into contact with so many different players as the head coach. So surprised because I tried to practice good safety measures, wearing a mask, social distancing, and those things. But as we found, every week we've got 2 opponents, COVID, and whoever we're preparing to play for. We're continuing to just try to fight this thing and move forward as best we can.
Thank you.
Yep.
Great. Next question, Pete Gilbert. Go ahead, Pete.
Hi there. I guess this is either for Damon or Coach. Is there a cutoff point at which the number, if you say had to cancel next week's game and weren't able to practice again, how long would it be before you would need like a full camp to get your team back to ready to play, and then maybe the season would not go? Do you have it in mind, or is it just day by day at this point?
Yeah, I would say it's day by day, as we've always operated. The team we've done all the things we could from an analytics standpoint to prepare our team physically and make sure that we're putting the team out on the field that's in great condition. And we feel like, the pause that we've had may have some effect, but if we can get back sooner rather than later, we feel very comfortable that, the science that we use to have our team prepared from a physical standpoint, the football piece is kind of the easy piece for these guys because a lot of it is mental. And as we get into the end of our season, we do less contact anyway. So it's more the physical conditioning piece that we need to monitor. And, I look forward to, finding out when we can return and getting our guys back out to get them in the type of shape we need to finish the season.
I just think I'd add to that. Our goal is to get back. I want to be clear with that, but we want to get back in the safest possible manner and make sure that we're looking out for the health, the safety, and the wellness of the student athletes. So we're committed to getting back. We're committed to doing things to get everything under control so our student athletes in the sport of football can get back to doing what they love to do, and that's playing this game.
All right, next question. Let's go to Jacob Steinberg. Jacob, you're up next.
I appreciate you guys doing this. Hope everyone's doing well. This question's probably best addressed for Dr. Rooks. I was just wondering if you could kind of detail us the procedures and steps moving forward from here with an outbreak kind of to this scale, both spreading throughout the team and the coaching staff as well.
Yeah, so as everyone has stated, it's a day-to-day thing. I'm up as early in the morning looking at our data, looking at our test positivity rate and we have a test positivity rate, the number of tests positive over the number of tests that we actually performed. And we look at our population positivity rate, and that's the population, that's the TERP family. Those not only the football players, but the ones who support the football players, the coaches, the staffing, the medical personnel. So I look at those numbers daily and I look for a trend. And if we're trending in the right direction, and honestly, at this day and age, I don't expect it to be 0-0. I want to remind everyone that this is not a football spread virus or a sport spread virus. This is a community spread virus. And so it is within our community. We are in PG County, Prince George's County, and Prince George's County positivity rate is 8.5 as of November 17th. It is on the rise. Our student athletes are citizens of Prince George's County, community spread. So I look at that, I look at the dashboard of Prince George's County, and I see the direction we're going with, and I make adaptations. I talk with the coaches, I talk with our athletic director, I even talk with the president of the campus, just on my thoughts and very transparent on how we can move forward. I will tell you that, we were trending down, and then we had a little uptick, and then we paused things again. We had an improvement today. We tested today. I'll look at the numbers and again this evening when I get them and make a decision based on tomorrow. But in terms of the game, obviously we have to make that decision in enough time to make appropriate preparations and not have a team come here and not being able to play. I look at having our young men, potentially if things stay the same, doing some kind of fitness or exercise training over the weekend, if possible.
Thank you.
All right, great. Let's next go to Barry from the Washington Post. How you doing, Barry? Go ahead and unmute yourself.
Hey, folks, thanks for doing this. Mike, I wonder if broadly you look at all across the sport, across the country. You're obviously one of several programs affected. And I wonder what you think about the season as a whole. Is moving towards a college football playoff and championship games and all that kind of stuff does it even fit into the landscape now, or does the season seem legitimate as everybody fights this? I wonder what your thoughts are broadly.
Yeah, I mean, we knew going in, and I think all of us, whether it's the Big Ten and all the other Power 5 conferences, understood what we were getting into when we made the decision to play. I don't think there's been any surprises with any of us, whether it's the uptick that we've seen in the last few weeks, as it was forecasted months ago that November would be a tough time for everyone. And as I've said before, the protocols and things that we've put in place as the Big Ten and as at the University of Maryland, I feel really comfortable that we've done the right things. Now, obviously, we're in a pandemic where it's a community spread here in our backyard, and I think it reflects that upon our team, much like Dr. Rooks said. So, yeah, not surprised. I think it's good for student athletes. Obviously, if we can get them back to playing where they are safe, healthy, and have, as well as the welfare of them being able to stay safe and healthy, I think it's important to continue to push through.
All right, next question. Let's go to Olivia. Olivia, go ahead. You're on next.
All right. Hey, Coach. This is for Coach Locksley. I hope you're doing well. I can't imagine how tough this is for young student athletes. I mean, it's tough for everyone, but for these kids that want to play football, what exactly have you told them to keep them happy? I mean, in good spirits, mentally and physically ready to go out and play. And what's one thing that you've said to these players?
Well, I think the big thing is that if you just look across the landscape of college football, I think there were 19 games the last 2 weeks that have been canceled. I know right down the street from us, Navy is coming off of 3 straight games of cancellations. And so as I've talked to our team, I've assured them that this is not a Maryland thing. This is a national landscape thing. And so, I look at what Wisconsin has done and how they were able to navigate their COVID spread. And I know Dr. Rooks and her staff has utilized that as kind of a barometer for how we need to move forward. And again, I feel comfortable that we have all the processes in place, and it's just a matter of when we can get back and start to get back to some normalcy as a program.
All right, great. Next question comes from Scott Abraham. Scott, you're on next.
Hey, Coach Locks. Hope you're feeling all right here, and thanks for taking the time. Obviously, this is a serious situation, and there's a lot of people across this country that may believe it's not a smart thing to do to continue to play this season. I guess, one, why do you think it's smart to continue to play the season? Why is it important to finish the season, given the fact that you have an outbreak with your team?
Yeah, I think those are all individual decisions, Scott. And as we've talked to our team about, we all knew going into the season, anybody that opted into playing knew that COVID was a reality and a real possibility, much like any other injuries when you play this game. And so, for us, I don't think it's any different than anything else. Again, if we made the decision to move forward and we feel comfortable that we have the processes in place that allow us to go out and play this game safely and in good health, I think it's good for our players. It's good for our program. Let's continue to move forward. Now, everyone, again, has individual decisions that they can make. And I can tell you our team they all understand where we are. They feel comfortable. We had conversations with the parents, and everybody's on board that we have the things in place from a protocol standpoint to keep their child safe and healthy.
Damon, can I slide over to you and get your perspective? Because, when is enough in a sense? Because obviously you have a lot of positive cases. You have 3 games left in the season. I guess the big reason I think people out there are wondering, why continue? Why put your student athletes, in that position?
Well, first and foremost, I think Locks summed it up well. We started off on this journey understanding what we were dealing with, not knowing all of the challenges that would come with this, but we knew that there would be challenges. And first and foremost, that we had to put protocols in place to move forward accordingly. And the Big Ten medical protocols gave us that opportunity to move forward. And then the things that we're doing as a university and as an athletics department. So where we are today, make no mistake about it has been a challenge for our student athletes, our staff, Coach Locksley, all those concerned. But I do believe that we have good medical people in place that are taking care of our student athletes. And when you start looking at those who have contracted COVID, the protocol that we have in place for return to play, I think is appropriate. And we'll continue to monitor the situation. As I've always said, it's day to day. What happens today and what may happen tomorrow may be very different. The landscape across our country, across the state of Maryland. So we'll just take it day by day, and we'll make the best decision for our student athletes in our program as we continue to deal with this virus.
Thank you all.
All right, next question, Bruce Feldman. Go ahead, Bruce.
Hi, this is for Damon and Dr. Rooks, I think. It seems like it's been a little ambiguous to follow in terms of how schools are defining the contact tracing piece of this. Could you kind of walk me through how you guys define the contact tracing part? Is it roommates or guys who were exposed to somebody who tested positive? Is it people in the same position room? Can you just kind of explain that part of it? Because I feel like it's been kind of vague.
Yep, Dr. Rooks, why don't we come to you for that?
Sure. So, direct contact basically is without a mask in the person of someone who potentially could be contagious with COVID for a 15-minute direct or cumulative 15 minutes within a short amount of time. So within shouting distance. So when we interview our young men and women in our sports program, a lot of them are, you know, wearing their mask indoors now because they've seen roommates and teammates become positive. And so really, and they're really practicing social distancing. So when we interview them, we say, we give this criteria. Have you been wearing your mask? Who are you in front of without your mask on for that 15-minute period where you're in close contact that you didn't have to shout to talk with them? And we write those names down, and those are our direct contacts. You can actually be a roommate now with someone if you're wearing your mask and you're cleaning behind yourself and you have separate bathrooms and not be a direct contact. So that's how we define it. And then we trace those people back.
All right, great. Next, let's go to Audrey. Audrey, you're on next.
Hi, this question is for Coach Locksley, and wishing the same sentiment well with everybody there. Just kind of curious, you know, you mentioned in your statement that you were gutted for your fans and for your team. And so what is maybe the most disappointing part about not being able to play last week and this week, and some of the emotions behind that?
Well, I think for us, it's that this team has really put themselves in a position to create value for themselves with how we played the last 2 weeks. Obviously, a big win against Penn State and a good come from behind team win against Minnesota really set us up as we continue to move through the growth phase of our program to generate, you know, momentum as a team and as a program. So biggest disappointment is that, you know, we haven't been able to continue the process of how we prepare and how we practice to put ourselves in the best possible positions to compete on game day. So to me, these guys have really made a ton of sacrifices from March on. I mean, you think about the pauses that we've had moving in and sacrificing by staying in the hotel in early summer for 3-4 weeks, then moving back in there for 2 weeks, and then most recently. So our players and staff have really made some great sacrifices in an effort to try to play, and to not have that opportunity is probably the biggest disappointment for me as the leader of the program.
And just real quick too, going off of that, what were your conversations? We were told, you know, Coach Tucker told us that he spoke with you. And so just what were some of those conversations like, you know, going back and forth this week, not knowing if, you know, you'd be able to play or not?
Yeah, you know, my conversation with Mel earlier in the week, you know, he sent the text and asked me, you know, what's the deal? And, you know, I FaceTimed him and said, look, we are preparing to play. I mean, this was early in the day, Monday, I think, when he sent me a message, and we FaceTimed for about 5 minutes. And I said, look, our goal, once we get the go-ahead from our medical people, is we're preparing to play. And he understood that. And again, this was the same process we went through a week ago with Ohio State. And it's the same process that we'll go through now as Indiana comes up on our schedule. You know, as a coach and a leader of the program, it's my job to get the team prepared to play. And so whenever I'm given the go-ahead by Dr. Rooks and the medical people, I've got to come up with the best possible plan to have the team prepared to go out and compete at a high level.
Thank you. Get well soon. Thanks.
All right, we have time for maybe one or two more. Let's go to Chris Gordon. Go ahead, Chris.
Okay, thank you all. The question is, what would be the timeline and how would you make the decision whether or not to play your next game against Indiana on the road? And if you can give us that, the timeline, the process, how do you decide whether or not to play the next game and continue the season?
Dr. Rooks, let's go to you for that one.
Yeah, like I mentioned before earlier, is that I'm going to be observing and looking at our information that comes in from our testing, taking a survey of how the team is doing, if there are kids who are not reporting symptoms and we notice that they're ill, but really looking at our numbers so we're able to put a team out there that is going to be safe. And again, I can't predict the future. It's a day-by-day process, and in communication with my athletic director, our president, and our head coach.
All right, last question. Thanks, everybody. Last question from Chris Solari. Chris, go ahead. You have the last question for today.
Hi, this is for Dr. Rooks. You mentioned earlier about the community aspect of it and looking at Prince George County. How much is being looked at from your end, both with teams coming in and their communities, and also with the state numbers in places that either will be traveling to a location or you guys would be traveling to?
Excellent question, and I'm glad it was asked. You know, I don't have a master's in public health and I'm not an epidemiologist, but I know a couple that I can rely on. And the mayors of the Big Ten, of which colleges are in, and also the health departments of which the Big Ten has schools, have met. They have collaborated and they have sent letters to the Big Ten office saying, you know, we're aware of this, we're concerned about this, we want to be on board with the policies and procedures. So the Big Ten has done a great job with sending representatives and talking with the local county health departments, talking with the states about, you know, the practices and things that we have in place. So there is that constant communication and transparency with the county. I don't have direct communication with our county, but I go through our health director, Dr. Sacred Bodison, who has direct communication with the county. So they know everything that we're doing, and we take that advice. They often make recommendations and not say you have to, but I know that the optics are high, and so I'm always transparent with our information, and thus far they've been okay with our policies and procedures. And I think it's that transparency which allows for a better working relationship.
All right, terrific. All right, thanks everybody for joining us. I want to thank Dr. Rooks. I want to thank Athletic Director Damon Evans and especially Coach Mike Locksley. Coach, we're all pulling for you. Get better soon. Go Terps. Bye, everybody.
Stay safe. Thanks for doing this, guys.
Thank you.